Lower facelift revision after 6 years, and CO2 laser. I had a lower facelift 6 years ago, then deep profractional erbium laser 3 years ago, which I felt did little to nothing. My neck area under chin is starting to droop again, and I want my wrinkles on face gone. My platysma bands are also prominent, which I treat with Botox. Could I get away with a skin-only neck revision and fully ablative CO2 laser?
Thank you for your question. You had a facelift 6 years ago with some CO2 laser, and then you said 3 years later you had a profractional erbium laser, which you felt did nothing. And now you're looking at yourself and you're noticing some platysmal bands, and your question is about doing a skin-only neck lift with CO2 laser, and you ask, can you get away with that? Well, I could certainly give you some guidance in the absence of a physical examination, of course. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic reconstructive surgeon, practicing Manhattan and Long Island for 20 years. I perform every type of face and neck lifting surgery, and this is a big part of my practice. And I can give you some guidance based on just the photos you've submitted, of which you submitted several. To begin with, the idea of what's called a skin-only neck lift can be interpreted in many ways, but I can tell you how I interpret it. When you say something like skin-only neck lift, basically what you're saying is lift the skin, but don't do anything with any of the support structure underneath. That includes the platysma, that includes the SMAS, and just pull the skin and then do a laser to then improve the skin texture and quality. That's how I'm interpreting it. Well, that being said, the thing to look for when I see someone like yourself is first has there been any softening or regression of the facelift part? Your face overall looks very good, but is there any part of this sagging below the jawline resultant that could be benefited from maybe a little bit of elevation of the face? A lot of times facelifts on people with skin that is very elastic, no matter what technique, deep plane or high SMAS or whatever you want to call it, the skin is often the weakest link, and the skin can stretch, particularly people who may live in areas where they have a lot more incidental sun exposure, as well as people who have genetically relatively thin skin and very elastic skin. So my first thing to consider when I look at your neck is that you have these platysmal bands. And although Botox may be helpful, right now with the photos you submitted, those bands look significant. Sometimes in surgery what I do is I look for these bands below the chin, and I either repair those bands by doing what's called a platysmoplasty, or I release those bands so that you don't see these continuous bands, because they're almost like a bow and arrow, like a bow, where if you release the band as the muscle, it separates. Sometimes it heals and it comes back, it's called recurrent bands, but that's kind of with the idea that because if you pull the skin, you make it a temporary improvement of the bands, but the bands will most likely stay. So in addition, there's maybe some value in pulling the platysma upward and superiorly and laterally. Again, these are more technical aspects of doing the surgery, and much of it I always think of as like being a sculptor, where while you're doing the surgery, you actually get a sense of the response. And of course, I have several assistants, and they often give me feedback while I'm doing the lift on how they like the way the face is looking when I move muscles in a certain way. This is truly an art form. So, and I would probably also caution you about more heat to your skin. You know, doing this for over 20 years, I was one of the first people or early adopters of the CO2 laser in 1995 and 94. And that around that time it was very aggressive, and it was considered quite a miraculous treatment. But we've learned all over time how the skin can get thin, and if you really are aggressive, the skin can become very thin as we get older and lose its integrity. You might actually benefit from something regenerative like what we do in our practice using platelet-rich plasma. But that's a separate issue. I think more importantly, you need to come up with a strategy that's most likely to give you back the structure that you want and then work on the quality of the skin. So I'd caution you about the aggressiveness of the laser. So again, meet with doctors. You know the routine. Meet with either your original doctor or other doctors if you feel like you want more opinions, and come up with a strategy. But again, I would say be cautious about doing the CO2 laser too aggressively. So I hope that was helpful. I wish you the best of luck. Thank you for your question.